podcast where we embark on a journey of self-discovery and collective growth. I'm your host, Luke DuBois, a therapist passionate about all things health and wellness. Joining me on this enlightening adventure is my co-host and beacon of serenity. How's that for a compliment?
What an introduction.
Zalmal.
What's going on, Luke? This is Zal. Good to be here again.
Zal is a wise and compassionate Buddhist practitioner, and together we explore the intersections of psychology, spirituality, and basically all things health and wellness, offering practical insights and, if not by us, our guests will offer, I think, some profound wisdom to enhance your overall well-being. So thanks for tuning in and joining our community. Please communicate with us through all the platforms, whether it's Facebook, Instagram, and YouTube. We'll make sure to put links in the description notes. So we're here to provide you with valuable tools and perspectives that can transform your life. If you find our podcast helpful, we greatly appreciate your support. And since we do not have a donate option yet, please feel to rate and share our podcast and with others. It's a wonderful way to support us. So please subscribe, comment, review, follow, and any of those potential options depending on the platform you're on. Remember, it's through our collective efforts that we can uncover solutions to all things related to health and wellness. So thanks for listening, and let's embark on this transformative adventure together where holistic well-being is within everyone's reach. It sounded pretty good, didn't it?
Great,
Felt good about it. So today we have the privilege of speaking with Dr. Mike Freedman. I certainly see him as a trailblazer in the field of primary and urgent care. Dr. Freedman is the owner and visionary behind Evolve Direct Primary Care and Urgent Care in Annapolis, Maryland. It's a healthcare practice that is transforming the patient experience. With a remarkable career spanning, I think, well over 2 decades, Dr. Freedman has earned a reputation for his unwavering commitment to delivering high-quality, patient-centered care. See a pattern here yet? His passion for revolutionizing the healthcare industry has led him to pioneer the direct primary care model, offering patients a more personalized and accessible approach to healthcare. Join us today as we delve into Dr. Freedman's incredible journey, explore his innovative contributions to the field, and gain valuable insights into the future of healthcare. Dr. Freedman, thanks for joining us.
Thanks for having me.
Yeah, thank you for joining us.
So, before we get into the potential flaws of the healthcare, kind of tell us about your professional journey a little bit.
Yeah, so I started out from fairly humble beginnings. I was the first person in my family to go to college. I really wasn't sure that I wanted to become a doctor or go to med school. Towards the end of undergrad, I eventually decided to get a master's in physiology, and while doing that, I really fell in love with medicine and the science of medicine. Somewhere through the course of that, when I was working in Philadelphia during med school, I had an opportunity to work with a lot of homeless folks. I just walking back and forth to school every day. I crossed dozens of people in Philadelphia, Center City, and I just couldn't walk past people without finding out who they were and what was going on and how they got there. And so I really got to know some people pretty well. And so I got my first taste of helping an underserved community in that setting while I was there. And then I went to residency, and when I came back here, I started practicing more of a traditional medical practice. Matter of fact, a block from where we're doing this podcast right now. And it was pretty standard, 4 or 5 people an hour and just rushing people through. But I found another underserved community there was a clinic that had opened up once at the Stanton Center at Clay in Washington. And so I found that I could go there on Thursday afternoons, which was my day off, and take care of folks. And it was just much more fulfilling than feeling like I was working for the insurance companies. And then, fast forward to about 2012 to 2014 timeframe when it just became unsustainable to practice traditional medicine for me. And I ended up moving into this new area that I guess we'll talk more about.
So besides the active service at the Stanton Center, and why did that feel so rewarding?
Yeah, so the Stanton Center, first of all, there was no insurance. No one had insurance. And so there was there was no strict time limits on how long you could be with someone. We didn't have guidance of what we could or couldn't do. It just had to be affordable, which was easier to do than, stay within the insurance framework. Mm-hmm. But you just felt like you could do what you were trained to do. You didn't feel like you had all the constraints and barriers that are built into a busy medical practice.
Mm-hmm. Now, I don't know if you're downplaying it, but did you develop that program?
Yeah, so I started, a couple of guys, Rich Bernstein, Rich Colgan, had started a year or two before me, and I think it was the first year that they actually had I can't remember if they had or we started, but shortly after that I joined, and we ended up expanding it pretty dramatically during
so much so, even though compared to other centers that weren't free, you got to spend these time with the clients a lot more than in your private practice. But wasn't it one of the nation's busiest free clinics?
It was.
Over 6,000 patients per year.
Correct.
Okay.
Yeah.
Okay.
Yeah, all 6,500 per year, all free. And we had the nice thing was we had a community on both sides. We had the community of folks that needed help, but we had this awesome community of the local docs from Anne Arundel, and almost everyone was willing to donate time. Whether it was to do, a hernia repair, an orthopedic surgery, a dermatology consult, whatever we needed, we had someone that was willing to see one of our patients, for no charge.
Yeah, if you don't mind, I'd like to hear a little bit more about that experience that you had when you were in Philadelphia.
Yeah.
Before we get into what you do today, because I have a sense that was kind of like an influencing experience for what you do, and wanted to hear more about your interaction with homeless folks and what, some kind of empathy from within.
I mean, it's just, it was, I still kind of don't understand how people can just walk by people every day. Mm-hmm. I mean, I take that back, because I'm a busy person now, and I think life hardens you the more you see that kind of thing. But it was new to me, coming out of suburbs and where I'd gone to school. It was university, and in Ann Arbor, Michigan. It was cold. There wasn't a lot of homeless people there. Not that Philadelphia was much warmer. But, just that constantly seeing the same faces, as you're walking home, and then starting to talk to people and getting to know their stories, it's just, there before the grace of God go I, number one. And number two is just, most of these people you come to realize, there's a segment of our society that would say, oh, you just need to get a job and work harder. But if you live outdoors and you don't have access to a shower and you don't have clean clothes, it's not that easy to get a job. And even if you could do all those things, chances are, there's a good percentage of the population that have, mental health issues, substance abuse issues, things of that nature, that, really require some help. In the 1980s, Ronald Reagan deinstitutionalized all the inpatient psychiatric places. So we used to, have these big psychiatric inpatient places where people would stay for their life if they couldn't function in society. And basically all these were shut down, and without a plan as to what to do with the folks.
They didn't reallocate services for them.
Correct. Yeah. So these guys, a lot of them, they either fell in a hard time, they got caught between rock and a hard place, or they, may not have had enough of, functional stability to stay stable and pay their bills regularly and be able to keep their place. And, I think a lot of us have gone through periods of time in our life where we weren't the most stable or the most mentally healthy. And, particularly in privileged communities, a lot of times you have a family, whether it's a mom, dad, brother, sister, someone that comes in to help you out. You can go stay at their place, something like that.
Yeah, I think it's fair to say in my experience, whether it's been personal or professional, what I can look back at all my successes, I've had some sort of support and help.
Yeah.
It wasn't just driven just by me, that's for sure.
Yeah.
Yeah. And being able to do that, and then it sounds like, you shared that you felt like you were able to give a certain level of care, whether it's in Philadelphia at the Stanton Center, that might have been even better or more quality time with these clients at the time. Mm-hmm. So how did that help direct you with your creation?
Yeah. Well, I mean, that hits the nail on the head, is that every Thursday afternoon I'd go to the Stanton Center and, I just would love it. I'd love the time I was spending with these folks, and I felt like they were getting much better care because I could spend the time to listen to them and get the correct diagnosis and explain the diagnosis in a way that they understood it, and in a way that they were motivated to do something about it. Instead of just saying, you have high blood pressure and you're going to die if you don't take this pill. Mm-hmm. You can explain what high blood pressure is doing specifically, and you can give them options. You can lose 40 pounds. You can walk, You
can see a therapist for stress.
Right. That's right. That's right. There's a lot of other options. But if you're not going to do all those, then you're between two options: die prematurely, or take what I got. Yeah. But when you can sit down with someone and explain to them why you're recommending a course of action and give them options, it's a whole different thing than just the traditional medicine where you got heartburn, here's a pill. You got depression, here's a pill. You got this, here's a pill.
Isn't it unbelievable it's come to this? It's almost like the human interaction, and I'm generalizing, in the healthcare industry has become paperwork.
Yeah.
It's a number.
Yeah. And it's the providers and the people doing it are, really good people. They're just, you end up with like 6 minutes of time with the person, and in that time you have to document your visit thoroughly enough to justify whatever code you're sending to the insurance company to hope that they'll reimburse you, which they automatically don't 30% of the time, just to make things difficult. So
that you work for it.
Yep. And you also have to document it well enough that you don't get sued, or when you do get sued, that you can cover yourself. That's right. And so there's a lot of other factors that have nothing to do with the interaction and the well-being of the person.
So do you feel part of the paradigm shift is the insurance is, I don't know if you'd say it this way, mandating the type of treatment as opposed to the professional, or is it just part of the context?
I think that the insurance is the elephant in the room.
Or the culture with it, right. At least.
Yeah. I mean, they're reimbursing a rate of, say, $30 a visit. Mm-hmm. And in order for a standard primary care practice to cover their overhead, the overhead's around $100 to $120 an hour. Mm-hmm. So that means you got to see 4 people an hour to break even.
Gotcha.
Mm-hmm. And if you're running real lean, you can maybe do it at 3. Mm-hmm. But real lean means when you call their office, the phones ring, you can't get anyone, that no one returns your calls. And if they're seeing 5 an hour, that means you rush through.
Mm-hmm.
So
the whole business aspect behind it.
Yeah, it's a no-win situation is what I finally came to understand. There's just no way of doing it in the insurance paradigm.
The way you would like to treat, and were able to treat.
The way anyone would want to,
yeah.
Quite frankly.
Good to know.
Yeah.
Hey, listeners. We've got something extraordinary to share, a chance to reshape your journey no matter where you are. You're familiar with Zal Mal's insights on our podcast, but there's more. Through the Recovery Collective, he offers life, mindfulness, recovery coaching, and meditation groups guiding you toward a fulfilled and mindful existence, no matter your location. Zal's journey from a Burmese Buddhist novice to a skilled practitioner equips him with timeless wisdom and contemporary strategies. Whether you're navigating life's shifts, seeking clarity, or pursuing self-awareness, Zal's coaching serves as a compass guiding you toward success. The best part? Zal's approach centers on your growth and empowerment. He equips you with tools to tap into your inner strengths for continuous evolution no matter where you are. Ready to take that next step in your personal growth journey? Connect with Zal Mal and the Recovery Collective at 240-813-8135 from anywhere in the world. Investigating in your journey reaps immeasurable rewards. Let Zal Mal guide you toward resilience, clarity, and empowerment no matter where life finds you. Now, let's transition back into our conversation. Stay tuned, stay curious, and keep your journey growing.
Yeah, I really like what you said about your experience at that center on Thursdays,
Yeah.
which also makes me appreciate what we're doing here too, is that I truly believe that stories inspire people, stories connect people. Mm-hmm. And when you connect at that level, you don't need to motivate them or force them to do something. They just feel inspired to do that. And which is also what I heard in Luke's description about what you do about the direct primary care, focusing more on the patient-oriented, like what do they need, and then fulfilling the need, finding out, instead of here's the formula that I will use, and then make it fit, So I really like that, and which kind of fits with what we do with Recovery Collective too, in a way that,
collectively we want to help these people, whether it's seeing myself for therapy, or Zal, or Jonathan with classical Chinese medicine, that we get to spend quality time for them to help themselves. It's a good model.
Yeah.
Yeah.
So I think at the end of the day, if step one is you have to want to help yourself, but we all of us can help people get to that place where because sometimes you have just been beaten down so much by life, you've kind of given up, and so I think we can help people get to the place where they want to help themselves, and then we can at least lay out a path for them. We can't walk it for them, but we can, and lay out a few paths, so hopefully something that's palatable, that isn't like a terribly high cliff or burning coals.
Doable.
Doable. Thank you.
Yeah, and we need help to do that sometimes.
Right.
Yeah.
So how would you define direct primary care, this model?
Yeah. So, So direct primary care, when I first started it, there was a couple in the nation doing something similar. I later found out. And subsequently, a concept which is really interesting. It's sprouted up in a lot of different places, almost independently, simultaneously, which is a good idea when that kind of thing is happening. But yeah, I looked at it, and I saw, places like, I'd be driving home and there's a nail salon, or, I don't know, a place selling art. I'm like, they're not moving $120, an hour of goods. There's got to be a way to do this in a way that's affordable. And so the idea of instead of structuring it that I get paid or the provider gets paid by doing more, seeing you more often, I wanted it to make it as easy as possible. I didn't want to feel like I was doing what I was doing to boost my income, a la carte. So in other words, if you've got high blood pressure and you're checking your blood pressures with a good cuff at home, you should be able to email me that or text me that. And I can see the numbers. They look great. You don't need to come in for me to...
You're in the range. We're not red flag right now.
Yeah, you don't need to sit in somebody's office for an hour or 2 hours waiting and, pick up some other disease while you're there. And,
And use it as a billable code.
Yeah, right. You take off a half a day. It's a hassle. A lot of us don't have time for that. Likewise, if you've got a thyroid condition and you just have to get your blood test every 4 months, 6 months or something, or cholesterol, and you don't necessarily need to sit down with someone and go through all that rigmarole, and you may not have the time to do it. So I think a lot of people end up not getting the care that they need because of the hassles. So a membership model where it's just a monthly amount transitions from, pay a la carte, pay for increased visits to a value-based. So you're just, it's similar to Netflix or streaming services or the gym. Yeah, you use it as much or as little as you need, and there's just no penalty for doing that. So those that need it more at different times, might use it more, and those who need it less at different times can use less. But we also don't have to coerce people to come in. Someone has a urinary infection, and they know it's a urinary infection, and they've had 20 this year. They don't. And nowadays, CVS sells urinalysis kits. You can find out if you have a urine infection. But most offices, my old office, we couldn't have treated you for that because we're not getting paid, and it's not.
I want to pull my hair out.
Yeah, but it's not an insult to that office, because that office could spend, literally, you could have a doctor spending all day long just doing that and not getting paid a penny for all their work, and just like. None of us want to go to work and not earn anything.
Because what the insurance would reimburse the office wouldn't be enough?
They don't reimburse at all unless you have a face-to-face visit with somebody.
Yeah. Oh, yeah.
So since COVID, there's been some more virtual work. But if you have a phone visit, if you drop the video from the audio, then you can't get reimbursed. If you have an asynchronous virtual visit like email or text, you can't get reimbursed.
What about the platforms that that doctors communicate, or nurses, or does that count?
No.
Yeah. It all makes sense.
No, it has to be. It has to be.
That's the back and forth, the unspoken. Yeah.
Right. You have to have a video component, apparently. To make it a virtual visit. And even then, a lot of insurances are covering virtual visits at a steep discount compared to in-person visits.
It almost makes me think that they don't want their clients to get better, the insurance companies. That's just me saying it.
Yeah. I'll abstain from that comment.
I do want to hear more about that part of I know, because, the beginnings are always difficult, especially for what you are doing, because it's kind of against the stream, right? It's not like a standard way of doing, but also probably very valuable challenges as well. So were there any experiences in the beginning days where it was quite challenging, but also in a way reassure, your unwavering desire to make this successful?
And if I can piggyback off that, the example that we just gave, a monthly membership seems to be valuable to do that with, like, the urinalysis, but then there's the perspective of, wait, I got to pay a monthly membership.
Right.
So that must have been one of the hardships. But go ahead.
Yeah. So, at the beginning, it was really difficult. So if you come up with an idea that isn't being done and people have never heard of it, it's very difficult, because not only are you having to try to recruit people to come join you, as patients, but at the same time you're trying to educate them about how this entirely different thing works. And I think people associate what they know, the next closest thing, and so unfortunately the next closest thing to what we were doing, where you're paying a X amount cash separate from your insurance, is concierge medicine. So there's still a lot of people who think that what we're doing is concierge. And the difference there is concierge is more like $2,000 to $4,000 a year. It's a much more expensive undertaking, and they also will then still charge your insurance company, and bill you for a lot of other procedures and whatever that you might have done.
So you're paying for the availability?
Correct.
Okay.
Yeah, access in essence.
Okay.
But I also, wanted to set a price that I thought was affordable, which we started out way too low, and we had to eventually work our way up to $49 a month, which still seems like like $1.25 a day or something like that. Like,
isn't every subscription at least that?
I know. It is roughly the average streaming price, but I try to compare it with cell phone bills, which at that time, 10 years ago, were not what they are now, and streaming services, which also were cheaper. Now. Yeah, cable. The many things that we have in our lives that we don't think much about spending money on, high-speed internet, cable, or access for TV and streaming, all those things. We do that way, but the idea of doing it in this area was very confusing. So it was very challenging in the beginning.
So with that subscription, what does that include? What does that entail?
So it's a little different in the state of Maryland and for Evolve than it is for basically the other 49 states. So the state of Maryland has had an insurance commissioner and a congressional and Senate group that have not been interested in really understanding what we're doing. And so there's strict rules and regulations about not appearing like an insurance company. So if you pay $49 a month and I tell you it's all the primary care you can eat for $49 a month, then they consider you an insurance company. So you have to be smart about it. And, so we have, you can either have a set number of visits per year or a set number of interactions per year, or you can have, in essence, charge another amount when someone comes in, which we do. We charge $25 per visit.
Okay.
Because the other option of trying to track how many visits you've had and say, okay, you're over your visits, then what? And then you charge them $100 a visit.
Kind of defeats the purpose of the access that you want.
Exactly. I really want to encourage, we want to encourage people to call us, text us, email us, come in. We're happy if you're using our service.
So if also a simple scenario that I have in mind is that if a patient comes and if there's a specific problem that requires specialist attention, is there a referral system too, or other specialists at your care as well? So
we don't have other specialists that are doing what we're doing because it's if you need a hernia surgery, you only need it once. So it's harder to find those folks. But there's a small group of specialists. There is a surgeon in Rockville that does cash-only surgery and for a set amount. But we've found folks locally, whether it's GI or surgery or whatever, that have wanted to work directly with us. And they're able to give us a discounted price that the patient then presents. So whether it's, getting imaging done for an MRI or, seeing a particular specialist. But we have access to all the specialists. And a lot of our patients have insurance. It's really designed well. There are some people that don't have insurance, though we encourage everyone to have insurance. for catastrophic stuff. But there's a lot of people that have a high deductible health plan. But, folks that are not sickly, that's not the right word. That don't have chronic medical illness. They're not spending $6,000 a year in an average year
to meet that deductible.
Yeah, so they're not getting anything out of their insurance.
Yeah.
They go see their primary care, they go see a specialist, they're going to get 100% of that bill, and they're going to have to pay it all until they hit $6,000.
I remember reaching out, looking at Zoll right now, not during peak COVID, maybe it was last year, 2022 or end of 2021. COVID was pretty happening and spreading, and I went to one of the other urgent cares in Annapolis, and I was there for 7 hours.
Oh.
And I remember texting Dr. Freedman. I said, "Why didn't I come to you? What was I thinking?" Because I could have used your service.
Yeah,
right?
Absolutely.
Because you guys are a COVID testing center.
Mm-hmm.
Take us through how that would work with one of your subscribers or not subscribers.
Yeah.
Just for COVID.
So now the way it works, and probably for the last year, 9 months, the COVID at-home tests have gotten good.
Yeah.
So it's rare that we have to send off a COVID PCR, to the lab. So most people call up and they say, "I just tested positive for COVID. What should I do?" And we jump on a either virtual call, phone call, or sometimes they'll just they provide enough information by text, and we text back and say fevers and how sick are you. And a lot of people are underestimated by providers. I think you can trust people a lot more so to know if they're about to die or not. Most people say, I'm sicker than I've ever been, I'm having trouble breathing. They'll volunteer these things that our textbooks say you have to ask, all these questions and get all these numbers, just basically CYA. But then we can just make a decision with them if they are going to take a medication like Paxlovid or something, and then we just send it in. They don't have to leave their bed.
Wow.
So, and then, back earlier in the COVID PCR days, we had a drive-through that was in the back of the building, and we would just have a virtual visit with them, have them go through the drive-through, get their PCR done, and we'd have the result back the next day. And again, all that billing went through for a long time. The government was paying for all those tests.
And the same thing, I guess the same thing goes for anything. If someone has the sore throat that they might think is strep, right? You have your protocol that is less intrusive and time demanding than if you were to go to primary.
But it's I'll tell you, like along the specialist question, it's amazing for instance, labs. So one of the benefits of being a member of Evolve is we have discounted labs. And if you were to get a vitamin D test at, Quest or LabCorp, it's $200. If you get it through us, it's $20. If you got a complete blood count, it could be $60. Through us, it's $4. Complete metabolic panel, again, like $60 or so. Our price is like $6. So
the subscription model helps with.
There's so much money, that the labs, the pharmacies, there's so many ways to save tons of money. I guarantee you every one of our patients is saving at least what they're paying in membership. Unless they have some kind of a plan where they get no deductible, no copay, no, or co-insurance, I should say. Some plans have 80-20 where, you're going to pay 20% of the bill. But we have ways of helping them find, their medications for, pennies compared to what they've been paying. And sometimes it's this identical medicine. Sometimes it's such a minor shift. It could be going from Charmin to
Sure.
some other brand,
Yeah.
good brand name toilet paper. It's like no different, and nobody would care at all. And I can take it from $400 a month to $4 a month.
But they wouldn't know that.
No.
Yeah, there's something very attracting about like meaningful relationships, right? Like especially when it comes to this healthcare system, because my parents, my dad was a doctor, my mom was a nurse, and I have great admiration for healthcare profession. I truly believe that it's a very noble profession, and but then everybody need access to that, right? Because that's also one of the training that I get, because I work as a medical interpreter, and then one of the training talks about doctors or healthcare professionals believe that life is precious, so, which is true, like life is precious. So you will do anything that is within your power to maintain that life, But then there's also a difference between doing it as a system and doing it like with heart in it,
Right.
And that's what I'm hearing from your practice, that your members feel understood, and you know them, they know you, and that it creates that meaningful relationship, as opposed to, this is what I'm supposed to do.
Yeah.
As opposed to, no, this is what I want to do for my health.
Yeah. Yeah, I think that, seeing 4 people an hour, 25, 30 people a day, it's really hard not to burn out and to start to get hardened, because you just don't have time to be as empathetic as you want to be. And you're really being taxed. Most docs are feeling burnt out, and as a statistically speaking, when you're feeling burnt out and you feel like your society's squeezing you that hard, it's really hard to be empathetic and put your heart out there for other people. Putting your heart out there and really listening and really caring. It takes your own personal wellness. And I always emphasize, my office, like, our patients are not going to be happy if our staff is not happy, if our providers are not happy, if we don't feel like we have the time to do what we need to do, if we feel like we're rushing around and we can't do what we need to do, it's not going to work. But it's, it's hard in, Western society as a whole, to not try to go as fast as possible and jam the system and squeeze every penny out. That seems to be the, I hope, last century's model. But, maybe this will be the future.
Yeah, happiness is contagious. It can be contagious.
It is.
In a good way,
Yeah.
And I think that's part of the culture. And for people, we'll send links to Dr. Freedman's practice, but his waiting room, and we've used it for community meditations at his practice. It's a hybrid. It's a mix between coffee shop and art studio.
Yeah.
So it's very welcoming. It doesn't feel like a sterile, cold medical office, whether it's in a high-rise or a strip mall or,
Yeah.
So it's engaging, it's welcoming. And I also think part of the unfortunate culture is stigma. Like you just said, the doctors, as someone that's seeking these services, it feels like the doctors don't care for some of the reasons that we mentioned. But to me, it's so valuable. I look for people that have the spirit or the heart of a teacher. And it sounds like you give the time, the ability to teach these clients that might need something. And if you're not the specialist, you have this referral source that you know and trust and use, whether it's for x-rays at a discounted rate, medications, but providers that you collaborate and connect with. So many doctors that I go see, I feel like, if my daughter needs a specialist, that I just feel like either they don't care, they don't know, or they don't have the time to educate me on what my child needs. And it's frustrating.
Yeah.
But you have the ability and time, and you do have the heart of a teacher. You do have the referral sources and the knowledge to do that. And I think we're getting so far away from that in general in terms of the medical field.
Yeah, I would agree.
To me, that can be valuable as a subscription. Wait, I can go to this person as an anchor, and if I need something more, direct primary and urgent care has the ability to refer me in a place that, I trust that they know where they're sending me, as opposed to, I better do more research, I better...
Yeah.
That cycle.
Well, and it's funny because there are some a number of things we do that we don't market or advertise because I think they're hard to convey. But one of the most important things, I think, is if we do need to refer you to someone, we're going to send you to someone that we know is the best of the best. And we're going to really, if it's something that is a little atypical, we're going to research it and figure out where is the best place to go. And if you call and they can't get you in for 4 months, we're going to help facilitate that when possible. Not always possible, but sometimes there's brick walls at Hopkins, etc. But
it's that warm handoff. It's we do it here when someone calls me for mental health therapy, and if they have a specific niche that I feel like I can help, but I don't specialize. Oh, but I know 2 or 3 people that do.
Right.
Really? You're willing to do? Of course.
Yeah.
I'd be glad to. Or Zal with his, Theravada Buddhism and knowledge, whether it's working with Zal or outside of our practice. Yeah, Zal is a wealth of knowledge in that. Why not? Collective solution to health and wellness. That's what it's about.
Yeah.
Yeah, the thing I want to go back to what you said earlier too, which is a good lesson for life in general. The difference between time and value. That we have, like, everybody has only 24 hours a day, which is all we have.
Yeah.
But then there's a big difference between making a better value out of a limited time, which beats the money, which beats everything else, because it becomes more about that meaningful relationship.
Yeah.
So I love that, because the value is in that meaningful essence that is created, as opposed to within this time we're going to fill in this amount of people, to squeeze the most benefit out of it.
It's funny you should say that, because it's taken me 5 years to figure it out. But when we first started, I thought, like, the fact that you could do virtual visits, that you could communicate, by email or text, a lot of those conveniences I thought would be the big draw, and they weren't. I thought the fact that we saved them a lot of money would be a big draw. That wasn't. And it turns out that it was same-day access, the fact that they can always get in and see us and we're open from 8 to 7, but if they call it like 6 or 5, then it's more challenging same day. And, quick phone access, etc. So it's more the value stuff, the availability, the time, the listening. People seem most happy with the fact that we really listen to them. A lot of the reviews say, I felt listened to for the first time in 20 years. So that probably can't be understated how important that is, how sad it is that they're not getting it otherwise.
I think you certainly answered a lot of the misconceptions already that I noted down, whether it's the lack of access to specialists. Well, you have that, the costly aspect. I guess the one thing that still jumps in my mind is, what is the call to action with people that do have insurances? How does it make sense in their mind in terms of conveniences there? Why would they still do it?
Yeah, so I would say, with the high deductible health plans, again, they're going to save money. With people, even if they have, as I said, no deductible, like we have in addition to what I was describing, a cadre of specialists that we really trust, we also have an online service where we can consult with specialists. It's a service we pay for, but we can take pictures of your skin rash, and instead of sending you to dermatology, we just send the pictures, and then they tell us it could be this or this. This is what I would do first. If that's not getting better, bring it back, do a biopsy, take a little piece of skin or something, or try something else. So there's a lot that we can do to save folks even more time and add value. But we've seen a big growth in Medicare age folks, and Medicare is probably the one insurance where they stand to benefit the least as far as financially, because Medicare pays well for visits, labs, etc. But most of the folks that are coming to us, it's because they just can't access care when they need it.
Yeah.
You know, especially with COVID, they were saying, you know, I was sick. They told me that they could talk to me in 2 days. You know, or they could talk to me the next day. But you know, if you're sick with COVID, you don't want to wait a day or two.
Yeah.
Or they get the message, you know, we're fully booked today, so either go to ER or an urgent care.
Yeah.
You know, and you won't hear that from us unless, you know, you call and say your arm is missing.
Mm-hmm.
And we might say go to ER.
What percentage of your clients are primary care, and what percentage are kind of that urgent care model?
Probably 95% primary care and 5% urgent care. So we don't. It's not our focus. It's the problem is, as far as growth, at least in the early days. We're not so worried about it now because there's a lot of word of mouth. But in the early days, you know, people aren't looking for a doctor unless they're not feeling well. And so it's really the only way you can, you know, build and see more people is if you're available in that way. But you also don't want to have, because it's a new model, you don't want to say, well, you can join us, you know, and for this amount per month. They're like, well, I've just got a urinary infection. Can I just get this treated? They may not want to do that. But then they come in and they get listened to for the first time, and
that's valuable.
They see how different it is.
Yeah. For example, stitches, right?
Right.
Yeah. I gotcha. Well, where do you see the healthcare industry going? Whether it's for you or just in general.
Yes. So the idealistic optimist side of me feels that, you know, insurance is an evil player, and I hate the term evil, because no one's really bad. You know, these are lost in some way.
That's generous. Go ahead, though.
We won't get into that. I really don't believe it anyway. You know, so. But I think you know, the insurance system and the way things are oriented currently is very perverse. It's set up in a way that is, you know, not well functioning, and you know, the latest attempt at changing the insurance industry with you know, the quote unquote Obamacare limited insurances to like 6 or 7% profit, something like that, per year, so they can't make more than 6 or 7%. I forget how the whole thing works, but what it skewed them into doing is, you know, buying these pharmacies and pharmacy chains so that they can bill more and create more billing. So they're actually driving up the cost at the same time.
Is that why there's shortages with medications and mental health meds?
No, that's
a different thing.
Yeah, we won't get into that. But there's a lot of us out there now. There's over 1,000 direct primary cares, and we usually, you know, get together. There's a couple conferences a year, and more there are a cadre. There's now health shares, which are similar to insurance, but where it's usually a fraction of the price of insurance, and it will cover you for catastrophic care, and usually mandates, you know, that you work with a direct primary care, because they know our job is to add value. Our job is to avoid emergency room visits, avoid surgeries where unnecessary, avoid unnecessary MRIs and testing. You know, that's where we give the most value, is not sending you to a million different people in order to get the diagnosis, actually listening and figuring out what the problem is and figuring out how to treat you. So we're hoping that will take over and insurances will disappear.
I guess that can certainly happen if there's research being done on it? Part of the 1,000, are you guys beginning to get in that mindset, or already doing
Yeah, there's a lot of great research, showing reduction in emergency room visit, reduction in surgeries, reduction in hospitalizations. So there's just it's no secret that having access to your primary care when you need them is critical.
Well, it sounds like this is already being scaled, because you opened up Evolve which year?
2014.
And how many were there then compared to, you say, over 1,000 now?
Yeah.
It's growing.
Yeah, it's really picking up. It's pretty amazing.
Great to hear.
Yeah.
Yeah. You didn't mention this specifically, but I gather that, healthcare is noble, but also like there's some kind of spirituality aspect to it, the way you're doing it, especially that part about being listened to, which is not something visible, which is something that cannot be marketed or described, but it's something that can be experienced.
Exactly.
So I love that. And I also want that to be part of the vision for the upcoming decades or years in the healthcare, because, healthcare need is not going anywhere.
Yeah.
Because people are sick, people are dying, that's always going to happen. But if there is more of that, being cared for, that connection, meaningful relationship, the more there is, the more people are going to be happy and healthy as well,
Well, and I'll take another step, Zaw. In that, I think that, what we're focusing on, and I think the future is not just treating sick people and not just preventing disease states, but actually helping people to find wellness, happiness, peace, figuring out how play, this actual study of happiness, and how to help people get there, that want to get there, and even people that don't know that they want to get there.
Music to our ears.
I bet.
Yeah.
Music to our ears.
Yeah.
Well, Dr. Freedman, is there anything else you'd like to share with our listeners before we go?
No.
Well, I greatly appreciate it. And Dr. Freedman has given us a great insight into the benefits of direct primary care and how it can revolutionize the healthcare industry. So thank you, Dr. Freedman, for joining us today and sharing your experience on this critical topic. We'll give links in our notes, but how could they potentially reach her in terms of Evolve? And
Yeah, they can always email us at info@emc4me.com. They can text us or call 844-322-4222, where our website is emc4me.com.
that will be in the notes, don't worry.
Yeah, thanks again, Dr. Freeman.
Yeah, it's
really
a pleasure.
enjoy the conversation. Yeah.
Thanks everyone for listening, and once again, please subscribe, comment, review, follow, like. If you think others would benefit from this podcast episode, share with others, as collectively we can find solutions to all things health and wellness. My name's Luke DuBois.
And this is all.
See you next time.